I now call Preet Gill.
It's a pleasure to serve under your chairmanship, Sir Mark, and I add my thanks to the Honourable Member for Waveney on securing this important debate, and I congratulate him and members across the House on putting forward a compelling argument for supporting our community pharmacy sector and increasing its role in the provision of localised community healthcare. I want to give my thanks to my friend, the Honourable Member for Knowsley, the Honourable Member for Winchester, Chair of the Health Select Committee, who made some excellent contributions, my honourable friend for Bradford South, who has been campaigning on this issue, and the honourable member for Tatton, and my honourable friend for Coventry North West, who herself is a pharmacist and shared her first-hand experience of some of the challenges and some great contributions today. It's a great pleasure to take on this important portfolio for primary care and public health. And in this year, its 75th year, the founding mission of the NHS to deliver care to everyone who needs it, when they need it, free at the point of use, is clearly under threat. 13 years of Conservative government has left the NHS flat on its back, and for my constituents and people across the country, their rightful expectation of an NHS with time to care when they need it are being trampled. Longer waiting times, a postcode lottery in care, and shamefully, for the first time in decades, healthy life expectancy falling in many regions across the United Kingdom, including the West Midlands, where I represent. It is one of the starkest indicators of how this government, far from levelling up the country, has let the country down. The NHS is Britain's greatest institution and my party's proudest achievement, and nothing gives me fire in my belly like the prospect of what a Labour government will do to fix it. Community pharmacy is a huge part of this, to relieve pressure on overstretched GPs and deliver first-class care and advice to patients. As many members have highlighted during this debate, it is high time for us to realise the potential of pharmacies, as with the vaccine rollout during the pandemic. They have proven time and again that there is so much more they can deliver as part of the primary care mix. They are the third biggest profession in the NHS, with around 13,000 community pharmacists across the UK, and altogether they prescribe over 1 billion medicines a year. Pharmacists are not only medicine experts within the NHS, but colleagues have also acknowledged their wider skills and knowledge that is underutilised. It is estimated that pharmacists give around 58 million informal consultations to walk-in patients a year. That's saving some 20 million GP appointments. And we know that drug-related problems, often resulting from poor medicine management, cause around 15% of hospital admissions, costing the NHS hundreds of pounds a night. So pharmacies have an enormous contribution to make to the wider system. Chemists do far more than just dispense repeat prescriptions and sell shampoo. They provide a range of clinical services and prescribing for common ailments and have a key role to play in public health and preventative services. There are great examples of innovative public health work that pharmacists are doing, such as in Bradford, where the Wise Up to Cancer initiative promoted health literacy among South Asian women, or the Jaunty Springs Medical Centre in Sheffield, where a shared care agreement between the pharmacy and GP surgery meant a majority of health interventions could be delivered in the pharmacy consultation room, freeing up the GP and cutting waiting times. There is good practice in pockets across the country that we should absolutely be building on. I know that ministers have belatedly acknowledged this, and there has been some expansion of the clinical services pharmacies offer in recent years. However, a few sticking plaster proposals really miss the opportunities that are there. So can the Minister update us on how negotiations with the sector over the Pharmacy First launch are progressing, and can he promise that this will be operational in time for the flu season? What consideration has he given to expanding Pharmacy First to establish a community pharmacist prescribing service covering a broader range of common conditions? He will know that in some countries that have been way ahead of the government on this, like Canada, pharmacists can prescribe for dozens of common conditions, freeing up millions of appointments in general practice every year. What is his long-term strategy to equip pharmacies for a future where their talents, capacity and expertise can be fully utilised and fix the front door of the NHS? We have also heard a number of concerns raised by members about the financial pressures facing pharmacies. I know the sector appreciates the additional funding announced in May, but of course this is tied directly to its expanded responsibilities as part of the primary care recovery announcement. This does not recognise, however, how current cost pressures are impacting the sector. Since the community pharmacy contract contractual framework was signed in 2019, the cost of doing business has continued to rise, especially since Liz Truss crushed the economy. The result has been that many pharmacies closing their doors for good, disproportionately in the most deprived areas, as analysis from the Company Chemists Association has found. Last year alone, 110 pharmacies shut up shop. Many more have had to reduce opening hours, services and staffing. So can he say what assessment he has made of the risk of more pharmacies closing down and reducing operations before the end of the current funding settlement in 2024, and what the impact this will have on the NHS medicine supply, the knock-on pressures on other parts of primary care and the prospects for extended clinical services in the community setting? As the Minister will know, the 2019 funding agreement was agreed on the promise that the government would drive wider efficiency savings and regulatory changes across the system. For many community pharmacies, the rollout of the hub and spoke model was an answer to this that would allow them to streamline their services. However, it's now been 14 months since the Department for Health and Social Care consultation on hub and spoke dispensing closed, and we have still had no response from the Health Department, nor the secondary legislation that was promised. So can the Minister please give us answers today about the considerable delay in progressing with hub and spoke reform? What actually is the hold-up? I would also like to raise the issue of staffing with the Minister. In the Community Pharmacy Workforce Survey released last month, it was revealed that there was a 6% reduction in the full-time equivalent workforce in 2022 compared with 2021. The vacancy rate for pharmacy technicians was about 20%, while it was 16% for pharmacists and 9% for dispensing assistants. Two-thirds of contractors said they found it very difficult to fill pharmacist roles last year. And in turn, the bill for local pharmacists is rising, up 80% in the last year alone. Many chemists are struggling to cope with the pressures, contributing to thousands of unplanned closures every month. This is bad for the taxpayer, but it's bad for patients. So what assessment has he made of the challenges faced by community pharmacists to hire, train and retain skilled pharmacy staff? Does he recognise that the government's workforce strategy has not kept pace with the scale of change in the sector? And does he share my concern that without a functioning community pharmacies network, the government's primary care recovery plan is built on very shaky foundations indeed? So Mark, the next Labour government has a plan to reform the NHS to shift care from acute settings to the community. As part of our plans to build a neighbourhood health service, we will realise the potential of community pharmacies, giving people services that they can rely on, can access earlier on their doorstep. That will mean accelerating the rollout of independent prescribing to establish a community pharmacist prescribing service covering a broad range of common conditions. It will mean cutting unnecessary red tape to allow primary pharmacy technicians to step up, ensuring pharmacists can work to the top of their licence and make more of their considerable expertise in prescribing and medicines management rather than repetitive dispensing processes. And all of this will be supported by greater digital interoperability, allowing the profession to support GPs in the management of long-term conditions. The Minister will have heard the broad support for the sector in this debate today as a trusted and cost-effective measure in addressing some of the chronic challenges we have come to expect under this government. I will look forward to his answers on what more he is doing to support this important sector and realise the potential of the pharmacy profession. Thank you.
Thank you.